Of the MHTTC Network Coordinating Office, and wanted to welcome everyone to our 5th and final virtual learning session, part of our National School Mental Health Learning Collaborative that we've been underway on since March. And so we're really excited about this 5th session on funding and sustainability. I would like to ask folks to please click on the link in the chat and sign in so we can send you materials for this and upcoming sessions, and also document your presence here. We'll be providing a certificate to folks who complete our survey at the end of today. And so we really want to know who you are and that you're here. I want to tell you that SAMHSA is very interested in this initiative in particular, and is always asking us, at least for numbers, we don't give them names, but for numbers of folks who were on the call and in the session. Next slide. Some reminders: if you're using audio through a telephone line, please mute yourself, or you'll come in as muted. You can unmute yourself using *6. Or if you're using computer audio, you can unmute yourself by clicking on the little microphone icon to the right of your name on the participant list, or sometimes down in the lower left corner of the Zoom screen. If you have any questions during the presentation, put them in the chat box. Excuse me, we also have an evaluation at the end of the session, and we really appreciate you taking the time to provide feedback. This evaluation at the end today is going to be an evaluation of the whole set of virtual learning sessions. And so we really would like to hear from you about how you found it, what feedback you have, good or bad. We want to know so we can make our trainings and learning collaboratives better in the future. Next slide. We're really excited to announce that our National School Mental Health Curriculum is now live on the MHTTC website. So that's going to include the trainer manual, the participant manual, the slide decks. There's 8 slide decks for each module of the curriculum. Those are all live on the website. You can also, and downloadable for free, to be used by anyone, but particularly used in the development and movement forward of any school mental health, comprehensive school mental health services that you have going on, either at the state level or at the district level or at the building level. This was a curriculum that we previewed people to during our in-person session in Maryland in March. And it is now up on the website and available for use. We'll also be posting the both the video recordings of these virtual learning sessions, as well as a transcript from each of the 5 sessions. So we're pretty excited. In our first week, it's been up for a few weeks now, and in our first week we had over 300 folks download the curriculum. So really excited. Please pass it on, let people know about it. We would love to have as many people as possible using it. And we're so thankful to our partners at the National Center for School Mental Health on their excellent, amazing hard work on this curriculum, as well as on our whole collaboration with them this year. We're just so thankful to have you all, Elizabeth and Nancy and Sharon and your whole team, as partners with us. Next slide. We want to remind everyone to connect with the MHTTC in your region. So our network is composed of 10 regional centers. So each of you has a regional center that provides training and TA services in general for mental health, but also very specifically for school mental health. So if you go to our website, which is mhttcnetwork.org, you can click on over in the left corner there, it says your MHTTC, and then find your center, which is the screen view you have right here, and choose which regional center is affiliated with your state or territory. And in addition, we have 2 national focus area centers, one on American Indian and Alaska Native populations, and one on Hispanic and Latino populations. So if you need special or specific resources related to those populations, please check out their websites as well. And all the centers have trainings and TA available on a range of topics. I think with that, on the next slide, I will turn things over to Elizabeth to get started on the agenda. Thanks, everyone. We're very glad to have you here.
Thanks so much, Heather. Can everyone hear me okay? Yes? Okay, great. So thank you so much for having me to present on this virtual learning session. My name's Elizabeth Connors. I'm an assistant professor at Yale University and also at the National Center for School Mental Health, and part of the team that developed this National School Mental Health curriculum. We're so excited to talk with you about funding and sustainability today. And to really start off the learning session, we wanted to return to some of the materials that are already in the curriculum. I was there with those of you who were able to attend the March meeting where we walked through many components of it, but it was very quick. And so we thought it would be best to start with really an overview of funding and sustainability in terms of definitions, some of the key indicators and the resources that you can access in the curriculum. We're also going to overview a new informational bulletin that's just released last month from CMS and SAMHSA related to Medicaid funding. So we wanted to make sure that you have access to that and know what is contained in it. And then the stars of the show really are guest presenters today. So we have Dr. Mark Sander, who is a senior clinical psychologist at Hennepin County in Minnesota, and also the director of school mental health there at Hennepin County and Minneapolis Public Schools. He is going to be sharing a district example of how funding and sustainability has really evolved in their district in Minnesota. And then wrapping up the call, we have the fortune of hearing from Dr. Janet Cummings, who is an associate professor in the Department of Health Policy and Management at Emory University in Atlanta, Georgia. And she is also the lead of the Southeast MHTTC. And so they've done a lot of work in understanding state policies that pertain to school mental health that could be leveraged for funding and sustainability. So she's going to tell us a bit about her state policy analysis at the end. So first, to start off, what do we really mean by school mental health funding and sustainability? This is a pretty broad topic as it pertains to school mental health, and many of us first think of the financial assets that we need to, for example, pay for provider salaries and services that are provided. And although that's true, the definition of funding and sustainability is much broader, and it really refers to all of the strategies that you would need to optimize your financial and your non-financial assets needed to maintain and improve your school mental health system over time. So funding is intended to cover the costs of your school mental health system, and it doesn't have to go directly to the school. It could be a funding partnership with the community or other partners to provide services to students and families. So if you think holistically about the system, what kind of funding do you need to support that? And then in terms of sustainability, this is really an ever-evolving concept, right? The goal of sustainability is to ensure that your operational structures and your capacity is sound, but also that your system can grow and adapt to match all the changing needs of your students, their families, schools, communities, and other systems over the course of time. So this is a list of all of the quality indicators that are included in funding and sustainability, and we're going to go through each one of them piece by piece. And so for each of these indicators, we'll also kind of talk about some best practices, resources, and helpful tips. We're not going to go as much in depth as the curriculum does. We're going to kind of hit on some of the high points. But these are basically the indicators that you would look to for school mental health funding and sustainability. You'll see that they include using multiple and diverse funding and resources to support a full continuum of school mental health. You'll hear today about kind of this recurring theme about the importance of having a really diverse funding portfolio, building in a lot of various partnerships to fund and sustain your school mental health systems, and not sort of putting all your eggs in one funding basket, so to speak. So starting with multiple and diverse funding is really important for that. And also related, we're going to talk about leveraging different funding and resources that you could do to attract potential contributors, making sure you have strategies in place to retain your staff, and maximizing expertise and resources of partners to support ongoing professional development and continuing education. We'll also touch on how to make sure that you have funding and resources to support a full continuum, a multi-tiered system of support from Tier 1 to Tier 2 and Tier 3. and also maximizing reimbursement for eligible services. So first, in terms of multiple and diverse funding resources to support this full continuum, this is really an essential component for building and sustaining a high-quality school mental health system. As I mentioned, you never want to have all of your funding eggs in one basket. And so to constantly be thinking about who could our new partners, collaborators, or funders be. There might be different levels that you think about in terms of funding. So the school level, local level, district, state, and federal. There are also lots of different types of funding, which the next slide goes over in detail. So if you think about, for example, grants, third-party reimbursement, cost sharing, private foundations, block grants, what are those funding types that maybe you're not tapping into yet that you could start exploring? And also thinking about the different systems involved. So the education system, the health services or Department of Behavioral Health system, public health, substance use, juvenile justice, child welfare. Where do these different systems fit in to your funding picture? And of course, you don't want just the variety of different funding sources that don't align to your particular continuum of care. So it's very important to outline what is it that you're looking to fund. I have some tools to share with you a little bit later on that can kind of help you walk through that, so you make sure your different funding sources are aligned to your specific continuum of care. Because you want to really establish and use a process to develop, evaluate, and update your financing plan. So again, you can kind of change it up and evolve as you need to over time, and regularly monitor potential new funding opportunities on the horizon. So this is just a list, as I mentioned, of funding sources that you might consider if you're looking to diversify. And there's just so many different examples within each of these. They're practically endless, but I'll just give you a couple. At the school level, you could think about principal discretionary dollars, funding from your parent-teacher organization, or private donations. At the local level, there could be general revenue, categorical revenue, taxes, or community businesses to support school mental health. At the state level, there are often block grant programs to develop school behavioral health infrastructure, your CHIP programs, Children's Health Insurance Programs, state health initiatives, and again, state level taxes that could be levied. Also, in terms of federal, there are project grants that, of course, come and go, but they can be really useful to implement some new programs and build some capacity. And then, of course, private foundations and donors to really support any private, pilot projects or promotion activities. Those can be really useful. This is a really nice issue brief that we wanted to make sure to call your attention to. It was actually designed by the Now is the Time Technical Assistance Center, and it provides schools, districts, and education agencies with strategies to access and utilize Medicaid funds to support school-based mental health services. And it really makes the important point that Medicaid reimbursement is widely underutilized in school districts. I've actually heard sometimes Medicaid referred to as a necessary evil in terms of school-based mental health, and you want to make sure that if you're going to use Medicaid reimbursement, that you're really maximizing all the types of services that you can reimburse for and the amounts of funding. So you don't want to leave anything on the table and really understand all of your options. Step one in this document actually recommends researching your state plan. So we'll hear a little bit later in the call from Janet about some ways to do that and understand about whether there's changes to your Medicaid state plan or just other policies in your state that could be very relevant. And this document also goes over lots of different hurdles that you might be facing related to Medicaid. So one example is IEP limitations, and they give really practical solutions. So it's a quick read, we highly recommend it, and it's in the curriculum. So next, as you think about leveraging funding and resources to attract potential contributors, the idea here is to use leveraging as, this is really a multi-party arrangement in which costs of a program are shared by involved parties. And specifically that the funds or resources given by one source is basically dependent on another source also giving funds or other resources. So basically one funder agrees to provide a certain amount on condition that the other funder is going to provide something. So an example of this, the City Behavioral Health Authority might commit funds to some portion of Tier 1 services in the school district, so prevention services, if the school district also commits a portion or some other kind of professional development. So it could be entirely different resources that they're providing, but they're conditional on one another. And so it can be really beneficial to leverage arrangements like this to attract different contributors who might be interested in supporting your school mental health system. So for this, of course, you're going to want to establish and use an agreement that outlines what has been agreed upon, and regularly seek partners that may have financial or non-financial assets that could be beneficial to your system, and keep those relationships strong, attend to establishing and fostering those relationships, and that will be very helpful in the leveraging process. So here's a few other tips just about leveraging funding resources. You may want to start with a comprehensive scan of existing funding opportunities. You probably want to do this regardless if you're going to think about a funding plan overall. And then again, going into establishing partnerships with new partners, maybe you already have, and or some you haven't, some that are new. A memorandum of understanding or an MOU could be very beneficial to document what's been agreed upon, and still really thinking beyond just dollars and cents, but consider exchanging services, trainings, resources that might be non-financial that could be helpful. The next indicator is really about making sure you have strategies in place to retain staff. So this is a great example of a very central resource to your system that you want to make sure that you are supporting for sustainability purposes. There are so many best practices related to staff retention, which is of course so important for student, family, and school staff relationships, having that trust, and it's also very cost effective. So not only does turnover in staff really influence the relationships and the school climate in the building, but it can be costly, right? If you're retraining new staff on initiatives, protocols, curricula, and also just onboarding in general. So paying attention to your staff retention policies and strategies is really important. And there's a variety of best practices listed here to just kind of give you ideas about different things that you could do. We did want to also highlight organizational factors in thinking about, beyond just individual staff self-care, which is one of the best practices listed for retaining staff. It is important to consider broader organizational factors that could be contributing to staff well-being and potentially reduce burnout. This is one assessment by Karen Guarino and colleagues that you could use to kind of assess some of these organizational factors and inform some action steps or quality improvement goals to improve staff retention. But it basically considers 5 categories: training and education for your staff, support and supervision, employee control and input, communication, and the work environment. You can see some sample items there on the right-hand side. So thinking broadly about staff retention. There's a nice district example in the curriculum of this, where a school-based mental health program really had kind of a multi-pronged approach to staff retention, including things like leveraging federal loan forgiveness programs and making sure that their clinicians were connected to those opportunities, supported in their applications, and that was something that really helped them, as well as providing really strong professional development. If you're talking about mental health providers, they typically all need continuing education units or other continuing training and professional development to maintain their licensure. So if the school and or community partners can provide that during their workday, it's extremely beneficial. And then even down to some of the more basic things, like making sure you're just celebrating staff accomplishments and milestones regularly, for example, in staff meetings. So So the next indicator is about maximizing expertise and resources of all stakeholder groups. So again, we know that professional development is critical for staff to be able to perform at their highest level of functioning. So you want to think about what expertise you have out there to really maximize your professional development opportunities. There's some ideas here that you could start with, which starts with asking folks who are recipients of professional development activities in terms of not only what they're interested in receiving training on, but what is their expertise? Because in many cases, if you look at the system as a whole, there's so much knowledge and expertise of those of us who are part of the system that you can sometimes leverage that to have staff train one another and really expand the skill set of everybody as a team. So really making sure that you're tapping into the diverse knowledge and skills base of all of the stakeholder groups and all of the partners that you have. And also thinking about, of course, engaging youth and family leaders and advocates as trainers and leaders themselves, as well as learners in professional development. There are some concrete examples here just to get you thinking. One is that community mental health providers may be able to train teachers on how to identify mental health problems. The second point is for school psychologists to perhaps train community mental health providers on school language and policy. If you happen to have community mental health providers for whom being in the school setting is relatively newer for them professionally. Youth and family members could train school-based mental health providers on effective ways to engage and support student mental health from their perspectives, right? What's helpful for them, what's not helpful, and what are some of the factors related to their engagement. And then also training school staff as trainers of an evidence-based mental health practice to train the larger community mental health workforce. So the next indicator is on funding and resources for a multi-tiered system of support. So this is really about putting it all together and looking to see of all of your tiers, what is the vitality of funding and sustainability for all of these components, as well as really maximizing reimbursement opportunities for eligible services, which are not just Tier 3 services. And so to underscore that point, we wanted to also share this resource because federal education funding is sometimes overlooked by school districts who are searching for sources of support for prevention. And this guide was actually developed by the Center for Health and Healthcare in Schools at George Washington University. And it's intended to help districts take advantage of funds kind of by identifying K through 12 grant programs in the Department of Education. And specifically, it provides really excellent detail on different elementary and secondary Education Act programs that provide appropriations for prevention-related activities. So another good read. And we can make sure there are links to all of these resources in the curriculum, but we can also make sure that you have the links as well. So there's some, in terms of maximizing the reimbursement opportunities through Medicaid, here are several different dimensions that can be explored to better support school mental health if you're thinking about Medicaid specifically. So first is maximizing the enrollment of eligible children by assisting, for example, with enrollment in Medicaid and CHIP, the Children's Health Insurance Program. You also will want to expand covered services and supports to see if you might be able to include teacher consultation, parent support, case management, and prevention approaches. I think Mark might touch on this a little bit later, but you might have to do an amendment to your state plan depending on your state Medicaid regulations to expand coverage for some of these services and supports, whereas some may already be written in. So that's definitely something to look into. You also want to create new provider types when relevant. So for example, parent support partners or graduate trainees, if you want to be able to leverage Medicaid dollars for that. Also using cross-system strategies to optimize funding. So, school mental health can be supported with kind of braided or blended funding or a case rate model if you're using different child serving systems that are a part of that. So it's something to kind of look into and see if that's a way to maximize. And then, of course, improving reimbursement methods in all of these various ways. So is it fee for service, prepaid capitation, or case rate? So if you want to think about this as a 5-step process for strategic school mental health financing and sustainability, this might be a way to go about it. As part of the National Center for School Mental Health National Quality Initiative, we did some virtual trainings and resources that were developed in collaboration with the American Institutes of Research to kind of help districts develop a strategic financing and sustainability plan, just because there are so many components here. And so this is the 5-step process that we developed collaboratively with them to kind of better understand and plan for sustainability of school mental health. And so this is intended to be kind of a continuous improvement process that school districts would primarily lead, but of course, with input with their partners. So first, you'll want to clarify what you will need and by when. That seems obvious, right? And then map your current funding and resources to figure out what you're currently working with, which will then help you determine gaps in, in different needs versus your existing resources. Then you're going to go about selecting your financing strategies and your funding sources based on this. So, at this point, you could kind of reflect and say which partners, for example, are not at the table. Could we use leveraging better? Do we need to be billing Medicaid? Are there components of our system that really need more funding? Are there non-financial assets in the system that we could be tapping into better? And then executing a financing action plan. So there are some worksheets. If you're an enthusiast of worksheets, sometimes this just helps make it a little bit concrete. So yours may or may not end up looking like this. But for example, if you wanted to clarify what you will need and by when, this is something you could use. So you have to figure out, what exactly you would need to pay for, the different kinds of services and supports, your infrastructure needs, your operations, any cost, and to figure out, over what time period you would want to do that in terms of building and sustaining. And next, you would want to, of course, map your resources, so what you already have to work with, the source, the amount, if there's any restrictions, operational spending, that sort of thing. And then finally, figuring out where are those gaps between needs and resources. So is it by, different services and supports? Is it by different subpopulations or fiscal year? So this is a worksheet that you can use, borrow, tweak, what have you, if it's helpful to you as you think about putting together a funding and sustainability plan. And this document is also another one that is useful to check out. It's developing a business plan for sustaining school mental health services, also put together by the Center for Health and Healthcare in Schools at GW. And it really describes how 3 communities and their lead mental health agencies work with schools and other local and state agencies to develop sustainable programs. So you'll hear yet another example from Mark in just a few moments. So before I hand it over to him, though, we really wanted to let you know about this new joint informational bulletin that came out on school-based services. It was just released last month from SAMHSA and CMS. It's about 20 pages of reading. It's very approachable, so we highly recommend it. In case your bedtime reading list is already a little long, we just took the liberty of kind of distilling the main parts in the next few slides. Just for your reference, so you know what it contains and have a better sense of whether this is something that you want to sink your teeth into. So this basically overviews what's contained in the bulletin. You could think about it as an outline. One of the things that's really nice is it just starts out off the gate justifying how important schools are to fill an urgent need to identify, connect, and support students. to mental health and or substance use services and support. So really just kind of calls that out in the forefront. I think that's always wonderful to see, to reinforce all the hard work that you all are doing day to day in schools. And then it goes on to outline several best practice models funded by Medicaid and non-Medicaid services. So some of them are listed here. You might be part of these models. You might be the developer of these models. You might be implementing these models. So I wanted to list them for you to check out because it's nice to see so many of these evidence-based and best practice models highlighted by SAMHSA and CMS. And they also talk about then various funding sources that could be used to pay for a full continuum of services, and also pay for best practice strategies to retain staff. So we see some of those themes from the indicators coming out in this document, as well as evidence-based practices to maximize return on investment, evaluating and documenting outcomes, which we all know does cost money and staff time, and then also cost to apply for grants. So it kind of goes through different funding sources. There are some state level strategies, and then really readable detail about Medicaid coverage requirements, state plan benefits, and other Medicaid authorities. So I encourage you to check out these different state strategies for financing that's highlighted in the bulletin. They're a great reference for ideas about what might be possible or modifiable or replicable in your own state. And so I think it's helpful to see what has been achieved in other states and think about how it might relate elsewhere. There's also then some very detailed Medicaid information, as I mentioned, so I'm not going to go over this in exhaustive detail. You do have these slides as an outline if you wish to refer back to them. But basically it explains that since there's no distinct Medicaid state plan benefit for school-based mental health services, states can submit a state plan amendment, SPA, to ensure that services provided are covered by Medicaid. So to some of you listening, this is old news, and maybe you've already done this and you've already amended your Medicaid plan. And to others, this might be newer information. So we wanted to share it as just kind of some foundational information for everyone to have. So states have to provide coverage for mandatory services and include a description of the state's payment for those services. But states might elect to include optional services as well. There are some requirements listed here for state plan amendments, which are described in detail. So for example, comparability is making sure that all enrollees receive the same amount, duration, and scope of services. So there are some things that your state plan amendment should really adhere to. And then it also reviews early and periodic screening, diagnostic, and treatment benefit, EPSDT, to cover school-based behavioral health counseling under the rehabilitative services benefit as part of the 1905 A13. Some other mandatory benefits to be aware of are physician services. So this could be leveraged to cover school-based psychiatric services, for example, and also federally qualified health centers or rural health clinics. So if you're in an area with a shortage of home health agencies or things that would kind of fit within this FQHC mandatory benefit, this could be leveraged as well. There are a number of optional benefits that states could cover that also could be used to support school-based mental health. So some of you may be familiar with some of these, and these will vary a little bit by your state, but it's important to know kind of what's mandatory and what's optional. And keep in mind that states need to outline a methodology for payment in the reimbursement section of their state plan amendment, even though they don't have to justify the coverage of services, because those are listed as optional. And there's just a variety of different payment methods that you could choose to outline depending on what makes sense. So finally, there are some other considerations to keep in mind that providers, for example, have to be qualified to work for Medicaid and meet all the requirements associated with such a position. And while the service coverage for school-based services are included in many state plans, you'll definitely want to seek some guidance to make sure that, you know, how you're operating, whether it's a school-based health center or other setup for your school mental health system, is kind of within, you know, federal guidelines. And finally, telemedicine might be a really useful medium for areas where it's difficult to get providers in the same room as students. So Medicaid reimbursement for telehealth or telemedicine could also be an option. So, you know, and I think just finally, I'd like to say that it's important to think about all the different kinds of providers that could be providing Medicaid reimbursable services, right? So if you're thinking broadly about everybody in your system, this could include school employed mental health providers or related services personnel, including school psychologists, school social workers that could be providing billable, you know, services, as well as psychiatrists who are based in the school, other mental health providers who are community partnered but school embedded, and then other trainees or health providers or other types of personnel that you have in the building that could be delivering reimbursable services. So we wanted to make sure that you have access to that document. It is in the box folder, so you can check out the PDF there. And with that, I'm going to wrap up and hand it over to Mark so he can tell us a little bit more detail about how they've done funding and sustainability in Minneapolis.
All right. Thanks so much, Elizabeth. Hey, everybody. So I want to start by setting up kind of how we have structured school-based mental health in Minneapolis. So Minneapolis Public Schools back in 2004 partnered with 2 mental health agencies. And through that partnership, those 2 agencies embedded therapists at 7 different schools. So we had a full-time therapist at each school, and through a Safe Schools Healthy Students grant, provided $30,000 for what we call ancillary services, which were treatment-related consultation, treatment-related care coordination with professionals outside of the school, and then also doing being at meetings such as IEP meetings, MTSS meetings, and other just kind of mental health team meetings, those kind of things. So then a large portion of the revenue for the therapist came from third-party reimbursement, either through public or private insurance. And then lastly, because we really believe that when we embed somebody in a school, they need to be able to serve all students regardless of their ability to pay. So Hennepin County stepped forward as a local mental health authority and provided some not to exceed contracts to cover the costs for the uninsured. So again, you got to have, like Elizabeth talked about earlier, you've got to have a very diverse funding portfolio and think about who should be paying for what based on either their interest or their responsibility as a player in the system. Another point which has been really important is data collection and evaluation were really key components. So related to data collection, we're not doing a research study here, right? So this is really about service delivery first, and then collecting data on that service delivery. So our data collection wasn't super rigorous, but it was also provided a couple peer-reviewed papers. So it was good, but again, that data was critically important for the next bullet, which was in 2007, 2008, there was our governor at the time was really interested in doing some mental health reform. And so we had some data on our program, and school-based mental health became one of the 5 key reform initiatives. And the governor and the legislature put $4.7 million a year for 5 years to help pay for that consultation, collaboration, and providing services for the uninsured and the underinsured. Again, the idea was you need to leverage third-party revenue first, and third-party revenue was at least half to maybe 75% of the funding for each of the programs, and then the grant funds came to fill in some of the gaps. Next slide. So one of the things that we did in Minneapolis in the beginning, we started small in 7 schools, and we really focused not only on how do we create this service delivery system, but also what's it going to cost, and what are the really important services that are necessary to make this program work successfully. And then with that, and some of those things were the teacher-related consultation, collaboration with outside providers, and being able to be embedded in the school and be at meetings and be visible. And what happened for all of that, we believe, is that it really helps build the capacity of schools to support individuals with mental health concerns, whether they are subclinical or really deeper end. And then as we were realizing what the critical services were, we also started thinking about, well, so who's benefiting from these services? And how do we engage these stakeholders? And these were school districts, health plans, county and state government. And then, like I talked about before, collecting program effectiveness data was critically important, and really looking at how much teacher consultation and consultation to social workers and consultation to administration were we providing. And we found of all of those ancillary services, 40% or more were related to teacher consultation, consultation with school social workers, and consultation to administration. So that really helped us move forward with this really needs to be part of the state grant program. And so in 2008, 2009, when the state grants came out, that was part of what was part of that program. So in 2009, when the grants came out, it went to about 20 mental health agencies, and they were serving 470 schools. And a couple years after the launch of that program, we assembled a high-level leadership group. And this had Department of Human Services, Department of Education, a number of superintendents, local county leadership, as well as our 5 main health plans in our state. And through this, and we had about 5 meetings that lasted about an hour and a half each. We really talked about school mental health, how it worked, and the stakeholders each developed their own commitments to help sustain and expand school mental health. Next slide. So due to the success, 5 years later in 2013, the funding for school-based mental health was doubled by our state legislature. Huge, and they were like, this is working great because of the data that we were showing them. And one of the pieces of data that I think was really powerful was we were able to show over each of the 5 years, 50% of the students that we were serving had never received mental health services before. And of those individuals who were receiving services for the first time, over 40% were found to be seriously emotionally disturbed, which means that they were at risk for out-of-home placement in the next year. So these were individuals who had significant mental health issues and for whatever reason couldn't get into community-based care. And now we've got over $11 million per year, and actually in this past session that just ended in May, there was some more money put in. So again, we're really expanding the services in Minnesota. One of the things that also happened in 2013 was the addition of a Medicaid benefit, which is called clinical care consultation. And so this is the consulting to teachers and also to the treatment-related consultation to individuals out in the community. So this was great news. And for individuals who are really looking into diving into their, adjusting their state plan with Medicaid, here's some things to keep in mind. This took a couple of years to implement. DHS worked really hard, but these kinds of changes can take a long time. And then some of the documentation required to access this benefit, I think, is limiting providers accessing it. So we're still working through really being able to maximize this benefit. So it's critically important, but it also takes some time. And then that the link below is to an explanation of this benefit. And if you'd like to talk to anybody at DHS in Minnesota, they'd be happy to talk to you about kind of this Medicaid benefit and kind of how they went through it. So big picture, kind of zooming back. So we started in 7 schools back in 2004. Now we're currently in 50 schools in the Minneapolis Public Schools, over 170 schools across Hennepin County, which has over 20 school districts. And across the state, we're now in over 1,100 schools, up from 470 back in 2008. So again, and a lot of this has been driven by the way that the state has provided these grants, and also school districts stepping up and wanting to pay for that consultation services. So for me, the big take-home message is make sure you have your data ready and your communication plans ready, because you never know when the opportunity is going to present itself to really start moving these programs forward. Thanks so much.
Thank you so much, Mark. That's really helpful. Does anyone have questions or feedback for Mark? You're welcome to type it in the chat. And I just wanted to point out as a reminder, so this is a model of a community partnered, school behavioral health system. And so we recognize, of course, comprehensive school mental health systems really include both school and school-based community supports. So this presentation is really about kind of that community partnered piece, and it's part of kind of the bigger funding picture for comprehensive school mental health. So thank you for sharing all of this, Mark. And if folks have questions or comments that come to mind, even throughout Janet's presentation, please feel free to type them in the chat. And Mark, if you're willing, if you could type your email address in the chat, that would be fabulous, so people could reach out to you offline if they wish.
No problem. Thanks so much.
Thanks, Mark. Okay, handing it over to Janet now to tell us about state policy and school mental health.
Thanks so much, Elizabeth. I'm Janet Cummings. I'm the school mental health lead at the Region 4 Mental Health Technology Transfer Center. And one of the things we've been working on is we've been trying to understand what the policy landscape around school mental health is in our region. And I'll give you a bit of an overview of some of what we've learned. But before I did that, I just wanted to say a couple of words about some of the resources that we've been using to learn about these policies, either pending legislation, recently enacted legislation, or executive actions. In case you have an interest in trying to learn more about what's happening in your state or your region. So the state legislature for each state usually has a database that you can use to search for bills in different parts of the process. And some of the search terms we've been using are just school mental health or school safety, because a lot of times language around school mental health is embedded within legislation that's addressing school safety more broadly. We've had discussions with leaders in our region, and some of what we've learned about the very important recently enacted legislation. Our state leaders told us that this had just happened, and they were actively working on trying to figure out next steps around implementation. I'm going to, in the next slide, present some links to a couple of additional databases as well that you may have an interest in using. And in some cases where maybe it's an executive action or legislation has not yet happened, we used news sources, just using Google to try to figure out what was happening with school mental health in that particular state. And that's actually been a helpful resource as well. So next slide. Here are a couple of policy databases that may be of interest. The National Conference of State Legislatures and the National Association of State Boards of Education. They both have interactive maps, and you can click on a state and see what's happening within a particular topic area. The Child Trends has state profile reports, and the link here to Mental Health America, it includes lists of current federal mental health legislation with links to some of the exact language. Next slide. So what does the current policy landscape in Region 4 look like with regard to school mental health? And I'll say in our region, and I think this is probably true in a lot of states and regions, a lot of the policy action has happened or has picked up ever since the Parkland shooting. So we'll start with Florida. Next slide. So in March of 2018, SB 7026, the Marjorie Stoneman Douglas High School Public Safety Act, went into effect. This was massive legislation, both in terms of all the pieces that were addressed, in terms of the resources that were allocated to the legislation, and $69 million was earmarked just for mental health services, and this was allocated to districts all across the state for school mental health. Then in Tennessee, later that same year, September 2018, I think that's the next slide, Tennessee allocated $35 million to improve school safety and security. And this had within it some resources related to school mental health. Again, these resources were split across the 146 districts. And there's also another more recent law, the SB 803, which established school safety grants and funded programs related to school safety. Some of these included topics such as violence prevention programs, conflict resolution, and a number of other topics as well. In Alabama, and you'll see here I'm going chronologically, the next slide, Alabama has not yet passed legislation. However, school safety legislation has been discussed, and in October 2018, the House Speaker set up an advisory committee with experts from education, law enforcement, and mental health. And the purpose of this committee was going to be to advise lawmakers on bills coming up in the subsequent legislative session on school safety. And we're continuing to monitor what's happening in Alabama. In Georgia, this slide refers to shortly after Governor Kemp came into office in February of 2019, he decided to allocate an additional $8.4 million to a program called the APEX program, which supports partnerships between mental health clinics and schools for the provision of school mental health services. And I'll actually say a little bit more about the APEX program after I cover the policy landscape for the other states. The next state we'll look at, Kentucky. Kentucky very recently passed another comprehensive law in terms of the extent to which the law addresses mental health, some of the specific language about requirements. I have an example here that beginning July 1st, 2021, at least one counselor in each school with a goal of having at least one counselor for every 250 students spending 60% or more time on direct services. That language is quite specific. For other states where there is currently legislation being considered around school mental health, or for those of you who are in those states and you know this type of legislation is moving through the process, I encourage you to check out, I've embedded hyperlinks into the slides that will be shared. Check out the language in Kentucky's law. It may provide some nice examples of how to get some very specific language into the legislation. And in Mississippi, they also recently passed a fairly comprehensive law, and it included a provision related to clinic-school partnerships. And then I'm just going to wrap up very quickly with South and North Carolina. Both states have pending legislation. South Carolina has pending legislation related to school safety. Both of them have language embedded within them that happens to address components of school mental health. And same thing in North Carolina. 2 laws are currently being considered. The SB 424 has language about funding school counselors and school psychologists over 3 years, for example. So this gives you a sense of there is just a lot happening at the state level, both in terms of legislation that's either being considered, very recently enacted, or programs that have been funded where there continue to be additional resources invested into those programs. So part of my take-home message after getting a sense of what the policy landscape looks like in our region is that this is just really an incredible time to be working and, you know, building off of Mark's presentation, having data ready, having your talking points ready for when that opportunity presents itself. The policy landscape is just very much at a place where there are opportunities, I think, for those types of conversations to really influence what happens next. I wanted to say a little bit more about the APEX program. So the Georgia APEX program was a program that began as a pilot in the 2015-2016 academic year. It is funded by the Georgia Department of Behavioral Health and Disabilities, and the idea behind the program is that the department would give grants to all of the public safety net providers in the state and a few private providers that served a large portion of children enrolled in the Medicaid program. And these grants would be used to help support these organizations to go and develop partnerships with the schools, to have the conversations, to create the relationships, and get memorandums of understanding in place to have those partnerships. But then the idea was that a sizable portion of what would then be delivered would ultimately be billed through Medicaid. So a lot of these partnerships, all of them provide Tier 3 services, and the partnerships are in schools with in which a large portion of the child population is enrolled in Medicaid. The grants can also be used to help support Tier 1, Tier 2 services that are not covered by the Medicaid program. Next slide. So here you can see how the program has grown since the first year. So this is some data for the first 3 years of the program. It started in 136 schools. You know, I think an important number, serving 2,400 students who were receiving services for the first time. And then as the program has continued, and I think there's been some data to show that, especially with the number of students receiving services for the first time, number of service encounters, that it is having a positive impact in the state. There have been more recent investments. In 2018, Governor Deal added $403 million to an existing $9.5 million budget. And then again, as I said, when Governor Kemp came in shortly after he got into office, he added an additional $8.4 million. And part of the idea behind these additional investments would be to take the program, help expand it to more schools. And then again, once those partnerships are in place, Medicaid becomes a very important piece of the sustainability of funding, and the organizations would bill Medicaid for those Tier 3 services. So I'd be happy to leave my email, and if anyone has any follow-up questions. I've also included links here for those of you who are interested in the APEX program. please check out these wonderful resources at the bottom. They have a lot of information about the history of the program, what's happened, the expansion of the program, and I think they'll both be great resources for you. So thanks so much.
Thank you so much, Janet. I think it's just when you had first told me about this program, I think it's a nice example of policies actually being leveraged and, you know, really translating to real actual services being provided for students. And the other aspect I like about it is funding that relationship building and the foundational work that it takes for schools and their partners to get to know one another. And I think that's a really innovative idea, and I think it could even be a potential ask of funders whether you're leveraging or braiding or whatever you're doing, to really seed the funding for the staff time that goes into building those relationships that we know is so foundational.
Mm-hmm.
Okay, great. Well, thank you so much for sharing. And with that, we want to move toward wrapping up our call. We are so grateful to Mark and Janet for their presentations. And yes, Janet, if you could put your contact info in the chat, that would be fabulous in case folks want to follow up with you about the policy analysis or the Georgia Apex program. I do see that there's some additional comments in the chat, some more clarifications about Mark Sanders' presentation, and Layla Fitzgerald also added that they're currently in 400+ schools year after year. So thanks for all the activity in the chat. I think as adult learners, it's always great for us to be able to be viewing the webinar and checking out what's happening in that chat. So we very much intentionally ended this, wrapped up kind of the presentation component of this last session early today. And that is because we don't want you to disconnect. We actually want you to use these remaining 15 minutes to complete the evaluation that's going to be posted in the chat box. As Heather mentioned in the very beginning, the evaluation of the entire series of learning sessions is absolutely pertinent and of very high interest to SAMHSA. So we appreciate you taking the time and going ahead and completing that evaluation. We want you to provide honest feedback, and there's contact information provided on the evaluation, and that will be used to send you a certificate of participation from the MHTTC Network Coordinating Office. And so I do want to hand it back to Felicia and Heather in case there are any other housekeeping details that I missed related to the evaluation links or anything else to wrap up the call today.
Thank you, Elizabeth. I think it's just me here. I think Heather is not back just yet. But yeah, I think if everyone would just be able to fill out the evaluation, I have posted the link into the chat box, and I will stay here till about 1:15 so that the chat can stay open for everyone with that link for those who need a second to copy and paste it or follow it to a browser. So I will have that open, and I will be here until 1:15 with that.
Thank you all very much. We hope you have a wonderful rest of your day, and we thank you in advance for completing the evaluation to let us know your thoughts on the learning sessions provided. Thank you.